Good evening, everyone. I just wanted to briefly try to summarize some of my thoughts that I had today. I was listening to my Google Nest Hub, and the CEO of insurance.com, I believe, can't remember very much about names, but it was from Cheddar. But they were doing a sort of podcast type of material about the healthcare costs and how they didn't really say it, but the reality of things are that capitalism is not working for the consumer the way it's designed to work. The way capitalism is designed to work is that things get better and less expensive to the consumer over time. Technologies, procedures, efficiencies get better, so it drives down cost, and it kind of levels out at cost and higher type of technology and better service. So it happens with everything. It's a good thing. People, companies, technology is designed to be better and to disrupt things, and for everyone else to try to raise their performance up to a certain standard, so that the outcome is that you give better services to the consumer. But the reality is that these hospitals and doctors just charge whatever they want to charge for everything, and they like it that way. And the insurance company gets a cut of that right now. So this isn't really so much of a message about, a political message. But if you really think about it, who questions their health care costs individually? Who goes to their primary care physician and says, Doc, how much is this going to cost? Do you Google your primary care physician and see what other people are thinking about them? Do you Google the specialist that person sends you to? Do you question, how much is this going to cost? How much am I going to have to pay out of pocket? Those are things you should be doing. And do you compare cost to other hospitals? I'm telling you, I do it, but it's extremely difficult for me to be able to do that. I can go and I can Google what the best telescope is, for example, what the best Fitbit is. Is this Fitbit a good price? Is it new technology? What does it have, et cetera, versus an Apple Watch or a Samsung Watch or a Garmin watch or whatever. I can do those things. When I go search for, an IT person to work for me, I can Google and see and find things and find out opinions about that person. I can talk to them, but just like that is my field. And I know that there are good people, there are average people, and there are people that aren't really worth being in the field. They need to probably go do something else. So I hope that I fit kind of in the mid upper range of that. I would like to think of myself as being that. I'm not an absolute genius. I am not the CIO of Cisco or any large company, but I do a pretty good job in my space. But there are also, those that can just the gift of gab, they can talk and they can make themselves sound smart and all that. I can weed those people out. But to even intelligent people that don't work in the field, such as CFOs and CEOs, a lot of times they're really confused as to who's given the right answer. I've been in conferences before and I'm going, this person doesn't know what they're talking about in the real world. They're new to the field and they're saying these things as if they're talking out of a book, for example. And these things in practice don't work for our situation specifically. And here's why. And I'll throw things at them and their pride gets messed up. And then I've got to just kind of backtrack a little bit and try to figure that situation out and hope that the people that need to be listening to me actually understand what I'm saying as well and choose the right thing. But there's usually, in coding, they talk about simple ways of doing things are generally the best. The most simple way to accomplish something is generally the best because someone could come behind you and you can explain that in simple terms. So that's generally the best way of doing things. And you can check back on your own work and modify things if they're simple. If they're super complicated and super all convoluted and everything, The outcome may, once you get it set up, it might work and it might function the way you want it, but just a little piece of that gets thrown out of the mix, and you've got to trace all those twists and turns, and it becomes a troubleshooting nightmare. So anyway, I don't want to, that was just, I digress. But having said that, we don't know who's good and who's not great at what they do. There's no real system that you can go out and Google it. You'll get a few opinions from some people. You'll get, but in general, you can't really nail, get a really good review on a doctor in an area or the exact cost of things versus going to, another hospital a couple cities away or something like that that is covered within your insurance plan. It doesn't work that way. You know it. I don't even have to go into detail about it. And then when you start asking about costs, we set these folks up on a pedestal and we say, oh, that's a doctor. That person went to school for X amount of years. But I guarantee you, if you talk to another doctor, they're going to tell you, that guy's good, or that guy, I'd stay away from him. They probably won't say he sucks or she sucks, but they're probably going to say, probably I would, me personally, I wouldn't use them because, they usually speak on, they don't want to speak that bad about each other because they know that they're in the field as well. Same thing with me. But there's no real good ranking system of these things that you can go to and figure these things out. And there should be. That would make a capitalistic system work for healthcare. Right now, it's actually socialized, but it's socialized for people in the medical field so that they can charge you whatever they want. And they like it that way. Healthcare, health insurance is so convoluted and so, you got one plan over here that has a large copays, one plan over here that only, covers 80% of your costs after your deductible is met. And this one costs, does 60%. It's all a big spaghetti mess, and it's done for a reason so that the consumer doesn't know what's going on, so that they'll pay anything just so they can have their health. So anyway, let's fix that. Or I don't know, you're going to have someone like Bernie Sanders coming in and knocking on everyone's door and telling you the government needs to just take it over. So couple choices here. Let capitalism work the way it's intended to work, so that people, so that competition drives the costs down and the quality up so that people are competing, or you socialize it. Two ways of doing it. Maybe something in between. But anyway, that's my thoughts for the day. It is June 20th, 2021, 9:45 p.m. Y'all have a good night.